I'm Dr. Nazanin Barzideh. I'm one of the vitreoretinal surgeons at New York Eye and Ear of Mount Sinai. I'm also an assistant professor as a faculty member. Age-related macular degeneration tends to be more prevalent in white Caucasian population. It is a little bit higher in rate in female Caucasians of Northern European background. So when you think about the blue-eyed, fair-skinned patients, and it's usually diagnosed after age of 55. There's a very strong genetic component to macular degeneration, as we are learning through very intense research actually lately. There's multiple genes involved that can be involved with macular degeneration. There's different types, there's different phenotypes. So, but it doesn't mean just because your parents or your grandparents have had macular degeneration, you're going to have the same disease. It does vary within individuals, and there is some environmental factors that is involved with macular degeneration. So the older population used to smoke much heavier, and that seemed to very much affect the disease for the worse. And now our newer generation, we don't have as heavy smokers as we used to, and we notice that the disease is changed in its progression and its and how it shows up. So you can usually see a general ophthalmologist who happens to be your cataract surgeon, or even an optometrist who can give you glasses. A lot of time we get our referrals through those sources, but really anybody who thinks that they have a family history, or there's something wrong with their vision, anybody who is over age 40, 45 with a strong family history or changes in the vision, most of the time macular degeneration can present itself as a slight distortion. I'm just having trouble reading a little bit harder in a dim light in a restaurant. So anybody can really be checked. And, if somebody calls my office and says, I like to be checked for macular degeneration, as a retina specialist, we certainly don't turn them away, and we're happy to do those consults, but it's usually through an eye examination. So there's two types of macular degeneration. There is the dry type, where there's no abnormal blood vessels attached to it, and that tends to be very slowly progressive in most patients. Again, different genes, different environmental factors. Each patient is affected differently. Even the two eyes of one patient can be affected differently with this condition. And then there is wet macular degeneration, when there is an abnormal blood vessel that does not belong underneath the retina, and it's actually causing scar tissue. It can cause bleeding, it can cause distortion. That tends to be a lot more aggressive, a lot more fast moving, and symptoms show up very quickly sometimes. And surprisingly, we actually have much better treatment for wet macular degeneration in the last 15 years. So if there is a significant change in the vision over a short period of time, it should not be ignored, because it can be treated. Dry AMD at the moment is managed with supplementation of vitamins and lutein and xenoxanthine, and through monitoring. And our monitoring has evolved significantly over the last decade or so. So we have much better instrumentation to really visualize the retina, and specifically the fovea, where macular degeneration is involved. So not only we can look at the blood flow and look for abnormal blood vessels, we have different modalities within our cameras these days, and we have a much higher resolution on our cameras as the technology has evolved. So usually my macular degeneration patients who have the diagnosis of stable dry macular degeneration are seen on a bi-yearly basis. And there are a variety of different things that they can do at home to monitor. And we are starting to see very effective home monitoring equipment that patients can really be involved. And I think that's really exciting for dry macular degeneration patients. So if you live very remotely, I can send a smaller version of my camera that I have in the office that you can actually, it allows you to monitor at home. And if there's a change, I get an email. And at that point, we go back to the patient and say, please come in, there is a change. So it's a very exciting subspecialty, and it's changing and evolving for the better very quickly. And it's nice to have that as a retina specialist. Wet macular degeneration tends to be a lot more symptomatic. So dry macular degeneration patients need more light to read with. They need sunlight tends to be a very significant factor. And, sometimes it could be as slight of a, I can't read as fast as I used to be for dry macular degeneration. But for the most part, they're going about their day without any trouble. Whereas wet macular degenerations, those patients are coming in and saying, I can't read. There's a distortion. I have a blank spot in the center of my vision that's getting bigger. I could see yesterday. I can't see today. I can't recognize details of a face. Things like that is usually part of symptoms that we see with macular degeneration, with wet macular degeneration. Macular degeneration can affect both eyes. So again, I look at it as two very separate diseases lumped together. I have patients that have bilateral dry macular degeneration. I have patients who have bilateral wet macular degeneration, and then I have everywhere in between. So some of my patients have dry macular degeneration in one eye, wet macular degeneration in the other eye. So yes, it's usually a bilateral disease, but there is a difference usually within the stages of disease between the two eyes. Unfortunately, at the moment, macular degeneration is not preventable by itself, given the fact that it has a very strong genetic predisposition. So we can't tell you that you cannot get macular degeneration. Having said that, there is many different things that can be done by the patient to change the environmental factors to either slow down the progression or not progress to a much severe stages of the disease. So for example, controlling high blood pressure, not smoking, having a healthy diet that involves a lot of green leafy vegetable, having enough lutein in your diet, which is kale and other supplementations can be used in the diet. That can significantly slow down the progression of dry macular degeneration. It can also, the not smoking and control of high blood pressure and control of cardiovascular disease in general can have a significant impact on not having a severe disease. So dry AMD at the moment, it's supplementation and really dietary changes and monitoring. Whereas wet macular degeneration, over the last 15 years, I would say since 2005, there's a significant change in how we treat macular degeneration. And, I've been in practice for that long, so I've actually learned along with my patients with the treatments, with the new treatments that are coming on board. And at the moment, it's treating wet macular degeneration with medications that gets injected in the eye, and it sounds really scary. And a lot of my patients, when I say that, are very taken back. But this is the standard of care, and you have to kind of trust your physician that you're not going to see the injection, you're not going to feel the injection. And we've made some very good stride with that. Additionally, the medications that are now available are significantly improved. So when I was in training, we had 1 or 2 injections that barely lasted 4 weeks, barely worked. If we were lucky, we were stabilizing vision, and most of the time patients were losing significant vision that was functional. So they couldn't read, they couldn't drive, and significant daily activities was limited. And fast forward 15 years later, most of my patients with wet macular degeneration are now having good enough vision to be able to drive. They are reading, they are leading a very independent life. And we've actually gone from different injections to a point that you're not in my office as often as you used to be, and there is actually an implantable reservoir that can hold the medication for about 6 months in the eye if you are within that category of needing it and wanting it. So it's a very exciting time because there's a lot of new things on the horizon, and the technology is improving significantly. So it's nice to have this very dynamic options of variety of treatments, whereas 15 years ago, we really didn't have a lot. I think getting a regular eye exam and having a healthy diet is paramount. But more importantly, your eye is an outgrowth of the rest of your body and your brain. So similar things kind of go with macular degeneration that we hear all around with, unfortunately, our the older population. If you have cardiovascular disease, make sure that you're controlling your blood pressure, making sure that your heart is in the best shape it can be. So having a healthy lifestyle, having a healthy diet kind of goes a long way. And that is very true with your eyes. Your eye is not an exception to the rest of your body. But having also, having a regular eye exam after age of 50 is, I think, is very important, because a lot of my patients come in and they don't even know that there was macular degeneration, even though it's a subtle change. They may not have any symptoms, but the earlier we diagnose even mild disease, the earlier we can have preventative measures to maintain their great vision.